Welcome to today's practical training video on the iTech Level 4 Diploma in Advanced Aesthetic Treatment, and we are going to be focusing on Unit UBT 466, which is in providing skin needling treatment. And in this video, we'll go through everything that you need to know about carrying out a microneedling treatment step by step. Now let's get to it. We are going to begin with how to set up your trolley for the treatment, and here you will find everything that you are going to need. On the left you have a list of all the skincare products that you would need to have on your trolley. Now keep in mind that all of your clients will have different skin concerns, so it will be entirely up to you to select the most suitable skincare products depending on the client's skin and their needs. And then on the right you will find the list with all the consumables that you need to have ready and prepared on your trolley, and make sure that your trolley in working area is set before the client arrives for the treatment. Once you have everything in place, you can begin the microneedling. Now let's look into what the treatment steps actually involve. And here you can see the full treatment protocol step by step, and we are going to go through each individual step in this video in detail. We do advise you to follow the treatment routine strictly, as results can actually be compromised if the products, equipment or techniques are altered or not included. Before we go into the step-by-step protocol, we need to do a few things to ensure that the treatment runs smoothly. You need to begin with having a consultation with your client, discussing what their skin concerns are. And this actually helps you determine whether your client is suitable for the treatment and also what products you would need to use for their skin. Next, you will need to check the client's consultation form for any medical history and contraindications, as well as whether they have signed the form. If the client has no contraindications, then you can take a before photo of the treatment area. Put your gloves on and place the headband on the client. And now you're ready to begin the treatment. Let's look at the first step of the protocol. We are going to start off with a thorough cleanse, which ensures that there is no makeup, grime or bacteria on the skin before we go ahead with the next steps. For the cleansing routine, you need to choose between two cleansers. You see, you have the ageless cleanser, which is suitable for dry, aging and the darker skin tones, and then the clarified cleanser, which is suitable for the oilier, congested, acne and blemish prone skin types. For this client, we went with the ageless cleanser. Her skin is quite dehydrated as well as dull. Take the cleanser you have chosen and dispense 2 pumps onto your fingertips. Emulsify the product between your fingertips and spread the cleanser all across the face. Start cleansing from the chin area using circular movements with your thumbs. Then slowly moving up towards the jawline, working your way up to the cheeks, and again only using your fingertips. Then you are going to use 2 of your fingers on each hand to cleanse around the lip, going from the left to the right, going crisscross. And from there, you're going to glide up towards the bridge of the nose, using circular movements, and slowly coming up to the forehead. Once that is done, you want to do 3 circular movements around the eyes, moving outwards. And finally, finish off at the temples by applying pressure. Once the cleansing is done, you are going to need 2 damp gauzes to completely remove everything off the skin. You're going to start from the right side, one hand gliding up and then followed by the other, slowly making your way up towards the cheek, and then moving on to the other side of the face and repeating the exact same process. Once that is done, you are going to fold the gauzes into half and glide towards the chin area, going up towards the mouth, then the nose, and lastly across the forehead. And on the forehead, move both hands sideways towards the temples and finish off your cleansing routine by applying pressure at the temples. If the client has lipstick on, you can carry out a lip cleanse. Apply 1 pump of the cleanser on a half damp cotton pad and spread that onto the other half cotton pad. Start cleansing from the right side, moving to the left. Move your hands simultaneously in both directions until the lipstick is completely off. For removing eye makeup, you need to apply 1 pump of the cleanser on a damp half cotton pad and start cleansing from the right eye. For this, you need to stretch the eyebrow, place the cotton pad on the eye and move downwards to take off any eye makeup. half the cotton pad and wipe underneath the lash line, moving inwards towards the eye and then outwards. Then you can move on to the left eye and repeat the exact same process until all of the eye makeup has been completely removed. After the initial cleanse, we are going to move on to the next step, which is using the ultrasonic scrubber to deep cleanse the pores. To use the probe, you are going to click on the skin scrubber from the menu. Make sure that the probe is on mode 1, which is the deep cleansing mode, and then press on start. To activate the probe, you would need to press on the little grey button on the probe itself, and then it's ready to use. Before going ahead with the scrubber, you need to reapply the cleanser all over the face. Use 2 pumps, emulsify the cleanser between your fingertips using a bit of water, and then apply it all over the face. Make sure that the skin is quite wet before going ahead with the probe. Take 1 damp cotton pad in your hand and switch the probe on. Start from the right side of the face near the chin area, and for this we're going to use smoke, quick strokes moving upwards towards the jawline. Once you have gone over the jawline, move higher up towards the cheeks and move towards the ears, repeating the same process. And as you're doing this, you will see that there is going to be a residue on the probe spatula, so use the damp cotton pad in your other hand to wipe that off as you're working with the probe. Once the right side of the face is done, you can move on to the left side and repeat the exact same process, starting from the chin area, moving outwards towards the ears, going towards the jawline and finishing off at the cheeks. At any stage you see that the skin is becoming dry, make sure that you do reapply water using your fingertips. The ultrasonic waves from the probe actually push the water into the pores, which then clears out all of the congestion and impurities, and this is the reason why you always need to make sure that the skin is wet, otherwise the scrubber will not be actually that effective. Once the cheeks are done, you're ready to move on to the forehead area. Start from the middle and move the probe outwards towards the temples. When one side is done, move on to the other side of the forehead and repeat exactly the same. Moving on to the nose, and as this is a very small and intricate area, you can use the tip of the probe around the nostrils. Apply some pressure when using the probe to get rid of any congestion on the nose. And finally, you're going to move on to the chin, and for this you need to ask your client to place their tongue under their lip. Move sideways and upwards with the scrubber, using small strokes and applying pressure as you go to deep cleanse the pores. And now that is done, we can move on to the next step. For this step, you are going to need the Clarify Peel Mask, which is suitable for all skin types, and it has exfoliating, hydrating and brightening properties as well. Take a medium-sized glass dish and squeeze a pea-sized amount of the Clarify Peel Mask. When applying the mask, only use one finger to spread it on the skin, starting from the right side of the face from near the chin area, moving upwards towards the jawline and the cheek. And once that side is done, you can move on to the left side of the face and apply the mask evenly all across the cheek. We use the Clarify Peel as the ultrasonic scrubber to ensure that there is no residue after the deep cleanse, and the mask also helps out any impurities of the skin to come out, which then prepares it for the microneedling treatment that we are going to carry out later on. Once you've completed the left cheek, you can move on to applying the mask all across the forehead, the nose, the upper lip and the chin, making sure that the mask is spread across the whole face evenly. Once the mask is on, you can use your fingertips to work it into the pores. We're using slow and very gentle circular movements all around the face, allowing the mask to exfoliate the skin. Do this for about 3 minutes and then leave the mask on the skin for another 2 minutes before removing it. To remove the mask, you need to use 2 damp gauzes. Start from the right side, one hand gliding up followed by the other, slowly making your way up towards the cheek and then moving on to the other side of the face, repeating exactly the same. And once that is done, you are going to fold the gauzes into half and glide upwards, starting from the chin, going up towards the mouth, then nose, and lastly forehead. In the next step, you are going to prep and tone the skin for the needling treatment, and for this we have a choice of 2 prep solutions. We have the Illumin Peel Lotion, which is suitable for the dry, aging and pigmentation concerned clientele, and then the Clarify Toner, which is for the oilier, congested, acne prone skin types. For this client, we went with the Illumin Peel Lotion as her skin is quite dehydrated, dull, with visible sun damage. You need to dispense 3 pumps into the solution onto a damp cotton pad. Apply the solution using the cotton pad, starting from the right side of the face, from the chin area, moving upwards towards the jawline and making your way up towards the cheek. Then moving on to the other side of the face and repeating the exact same process and spreading across the toner all across the face evenly. Once that's done, moving on to the forehead, going towards the temples on each side and then going across the nose, upper lip and finishing off at the chin. Once you've covered all areas, you can move on to the next step. We are actually going to be carrying out the microneedling using different types of stem cells. Now here you have 3 different stem cells and you can see all of them have been formulated for a specific skin concern. For example, you have the ageless stem cells that are for dry, dull, aging and sun damaged skin. The Clarify stem cells are for the oily, congested, acne and blemish prone skin types, and then the Illumin stem cells are for the darker skin tones with hyperpigmentation concerns. For this client, we chose to go with the ageless stem cells as her skin is quite dull with visible sun damage. Before going ahead with the microneedling treatment, you need to set up your Dermapen that you're going to use. First, remove the packaging from the needle. And place the needle into the Dermapen by screwing it into the pen. Adjust your needle size by rotating the top half of the Dermapen. Select a 0.5 millimeters needle size. And for the intensity of the pen itself, rotate the lower half of the pen and select mode 5. To switch the pen on, select Dermapen from the menu and press on start. Starting from the right cheek, apply 3 drops of the stem cell serum and use your fingertip to spread the product evenly all across the cheek. Place the Dermapen directly onto the skin and use quick stamping movements. Starting from the chin area, we always work in small sections at a time. Moving your way out towards the jawline and then going up towards the cheek. And as you are going along with the Dermapen, use your fingertip to massage the stem cells into the skin. You can switch between circular and stamping techniques. Just make sure that you are working small sections at a time and not dragging the pen across the skin, as that would actually cause any track marks left by the Dermapen. The right cheek is done. You can move on to the left cheek and repeat the exact same process by applying 3 drops of the ageless stem cells and then carrying out the microneedling. By doing the stamping technique on the skin, this opens up microchannels going all the way down to the middle layers of the epidermis, which delivers the stem cells and also causes controlled injury to the skin, which then induces the cell turnover and rejuvenates the skin completely. Once the cheek is done, you can move on to the forehead and repeat the exact same process, and you can also switch between the stamping and the circular technique. While you're on the forehead, be very gentle with the pen as the forehead is quite bony with thinner skin, and while you're doing it, always make sure that you don't see any blood spotting. You should not be seeing any blood at all as you're doing this treatment, and if you do, you need to lower your needle size or you have to back off with the pressure. Once you've completed the forehead, you can move on to the nose, upper lip and the chin area, again just using stamping techniques and applying the stem cells on the skin. Once the microneedling is completed all across the face, use your fingertip to gently massage any leftover product into the skin. And you are now going to use one of the revival serums in combination with the no needle mesotherapy. You have a choice of 3 different serums and they all have been formulated to treat a specific skin concern. You have the Ageless HA serum for the dry aging skin, the Clarify serum for the oily, congested and acne prone skins, and the Illumine, which is for the darker skin tones and hyperpigmentation concerns. For this client, we went with the Ageless HA serum as she has very dehydrated skin. Before going ahead with the serum, you would need to switch on the No Needle Mesotherapy probe, select the No Needle Mesotherapy button from the menu, adjust the setting on 5 and press on the start button. And now you're ready to begin. Apply 3 drops of the serum on the right side of the face and spread it across only using one finger. Place the probe on the skin and use very slow circular movements, starting from the chin area, moving up towards the jawline and then the cheek. We actually used the ultrasound probe after the microneedling treatment as there are already microchannels that have been created by the Dermapen into the skin, and the ultrasound will only optimize the penetration of all the ingredients, and we're also pushing the serum as well as the stem cells into the deeper layers of the skin, which completely then optimizes your results. When the right side of the face is done, you can move on to the left side and again repeating the same process by applying 3 drops of the serum, spreading it across evenly with one fingertip and then carrying out the no needle mesotherapy. Once the left side of the face is done, you can repeat the exact same process onto the forehead, the upper lip and the chin. Once you've covered all areas, you're ready to move on to the next step. Next, you are going to use the Skin Rejuvenation Sheet Mask, which is a skin soothing and it has been specifically formulated to be used after treatments such as microneedling or mesotherapy, for example, and we will use this mask in combination with the LED light. Take the sheet mask and open it up gently from the top. Take the mask out of the packaging and slowly place down to the client's skin and gently adjust the corners of the mask. Once the sheet mask is on, place 2 halved cotton pads onto the client's eyes and follow with the blackout goggles. You are going to need the blackout goggles for the LED light, and this is actually a health and safety requirement when you're carrying out LED therapy. Now you are going to use the LED light on top of the sheet mask, and for this you need to switch the probe on, select LED photon light from the menu, choose the type of light you need to use and adjust the intensity to 5 and press on the start button. Place the 2 probes directly onto the skin and slowly glide sideways across the cheeks. gently move your way up towards the forehead and temples. For this client, we have chosen the green LED light as it is skin soothing and is ideal to use after a microneedling treatment, as there could be a bit of erythema after carrying out the Dermapen. You can also place each probe directly onto the skin and stay in one place for 30 seconds, allowing the light to penetrate into the skin. Carry out the LED therapy for 5 minutes, and when you are done, gently remove the goggles, cotton pads and sheet mask off the skin using your fingertips. If there is any extra solution left, you can gently use your fingertips to massage it into the skin. Remember, don't wipe anything off. And for the last step of this treatment, you are going to apply the Illumine Moisturizer, which is the Revival Sunblock that acts as a moisturizer as well as a sunblock and is suitable for all skin types. You need to dispense a pea-sized amount of the moisturizer onto your fingertips. Spread the product between your fingertip and apply it starting from the chin area, moving up towards the jawline and cheeks, and lastly the nose and forehead. To spread the sunblock, use gliding and circular movements, applying it evenly all across the face. That is done, remember to take an after photo of your client and remove the headband, and then your treatment is complete. Remember to give your client the aftercare advice, and that is very important for them to know how to actually look after their skin after the treatment, what they can do and what they can't do. And remember, whenever you're carrying out a microneedling treatment, you always need to let your client know that they need to wear sunblock every day for the next 7 days while the skin is recovering. You need to recommend suitable skincare regime for them based on their skin concerns and needs, and advise them on what the next treatment should be and also when. And that is everything you need to know about carrying out a microneedling treatment.